Well, welcome everybody. I'd like to welcome you to webinar. My name is Adrian Te Patu, and I am the chair of the Indigenous Working Group of the World Federation of Public Health Associations. It's wonderful to see you here, and we welcome you to this. This is our third webinar that the Indigenous Working Group has run. The first one was Decolonizing Public Health, a creative language for action. That was followed by a second webinar, which was for Global Public Health Week, decolonizing the role of rethinking the paradigm. And now we're here with our third webinar online, which is focusing on education and training. So I thank the speakers who are joining us today, our panelists, and I'll just start us off in a traditional fashion. Nō reira, tuwaka ki te mihi atu kia koutua huhi mai nei I tēnei rā, nō reira okunanga tera, orino tēnā koutou, tēnā tātou. Nā maunga whakarakara ka tū hono mai koutou, nā tūpana tūtonu, ki te taho uru o te wakatapu, ei toka ahuru, ei toka marino, whakakapua mai e koutou o koutou korowai hoka teo hauhui a tihei mauriora. So welcome everybody. So we have a window of 1 hour. So the plan or the agenda is that I'm going to invite the president of the World Federation of Public Health Associations to give an opening address. Then I'm going to invite our panelists to introduce themselves, say a few things about who they are and their expertise and notions into this particular space. Then we're going to open it up for opportunities for people to invite questions, and then we'll have you outside the terminal in about an hour. So without further ado, they also just want to acknowledge that the links to the previous our previous webinars are in the chat also, and also what we'd like you to do is to just in the chat tell us where you're coming in from across the planet. So kia ora tātou. I'll now hand it over to Emma Waimari Rawson-Te Patu, the president of the World Federation of Public Health Associations. Tēnā koe Emma.
Tēnā koe Adrian. Tēnā koutou katoa, tēnei te mihi atu kia koutou I te pō, I te ata, I te ahiahi rānei. Hello everybody, it's a real pleasure to be with you all this evening or this morning or this afternoon, depending on where you are coming in from around the world. I've just greeted you in my language, Te Reo Māori, and as Adrian has said, I am the president of the World Federation of Public Health Associations, the first Indigenous woman to hold this position. Just really grateful to be able to be with you all tonight on yet another webinar focused on this really important topic of decolonizing public health globally. As Adrian's mentioned, this is another in a series of webinars that we are committed to running over the next couple of years in order to help to socialise and educate each other, I guess, and ourselves on what does it mean to decolonise public health and how can we help and support each other to understand the actions that we can all lean into as part of decolonising public health and removing barriers for those of us that most need that. I'm just going to ask Maria if she could please share the screen. I've got some slides that help me show you some of the tools and resources that we're coming up with at the Federation. Thanks, Maria. If we might just move to the next one. And possibly the next one. Thank you. Okay, great. So this one tells a little bit of the story so far in terms of the Federation's commitment to the conversation on decolonising public health. And I want to start with this because I think it's really important to acknowledge that the World Federation of Public Health Associations is, for all intents and purposes, a mainstream public health civil society that for many, many years has you know, has had one particular face, and now we are able to help it to understand its roles and responsibilities in regards to, in the first instance, Indigenous populations and Indigenous equity. And in that conversation, we have started to understand what the Federation can do in terms of leading into its responsibilities and obligations to understanding decolonising, and then sharing that throughout its membership, so that our broader members within the Federation can begin to know and understand what they can do in their different spaces and contexts around decolonising public health. So when I talk about our membership, the World Federation is made up of over 110 member associations, so national associations that are members of us as a civil society. That equates to about 5 million individual practitioners globally. So it's quite a large number of our workforce, and it's a huge opportunity for us to be able to say we are making a commitment to this thing we call decolonising public health. And one of our first real sticks in the sand around that was in the beginning of 2023, when we adopted a new goal, which was contribute to promoting systems change and decolonising public health. And you'll see that there as point 2, so goal 2 of the Federation, contribute to promoting system change and decolonising public health. And since then, we've been on a journey to do that very thing, is to understand and define what it means to decolonise public health, which is a really huge area in and of itself, but we had to start somewhere. And so in November in 2023, we promoted a definition that we had drafted as the Indigenous Working Group of the Federation, and then more broadly within the Federation, beginning to define what it means to decolonise public health. And we've been doing a number of other actions since, which includes these webinars, includes a side event that we held in Geneva during the World Health Assembly just this past May on the Indigenous determinants of health and how to operationalise the Indigenous determinants of health as another mechanism for decolonising global public health. Maria, if we might have a next slide, please. Again, this is just talking about what I've just been describing in terms of the Federation's commitment to building a program of work supported by the Indigenous Working Group to lead action on what that means now that we've got a definition of what it means to decolonise public health as a starting point, and then how we can work with others and create tools and resources of our own to help to support our members and the broader public health community. Thanks, Maria. Next slide. Okay, and here we have just our draft definition that we came up with in November last year, and I just want to recognise one of the speakers on our panel this evening, Dr. Ariana Andrews, who was key to pulling this together along with a number of other members from our Indigenous Working Group. And our draft definition that we came up with is this: decolonisation is an individual and collective process that involves actively resisting forces of colonialism that perpetuate the subjugation and or exploitation of Indigenous minds, bodies and lands. Decolonisation in public health takes many forms, including revealing and analysing the historic and contemporary impacts of colonisation. This therefore includes overturning colonial structures that perpetuate inequities in health and the determinants of health, and realising Indigenous liberation, self-determination and well-being. And again, as I say, you know, we very much from the Indigenous Working Group of the World Federation position know that we represent the faces of indigeneity that comes from New Zealand, Australia, Canada and the USA, and that there are many other faces of indigeneity that are part of this conversation as well, and indeed of decolonising and colonisation. It's, for us, we were sure that we needed to understand where we were coming from in this context, and very much importantly, centre indigeneity in the beginning of this conversation, which is where it belongs, in order to then understand where the rest of the nuances and the rest of the faces fit in this picture. Thanks, Maria. If we can move to the next slide. This is just the references for the definition, and then the next slide, please, Maria. And now we come to, this is a really important piece for me in this conversation before we go into the conversation with our panelists after this, is we, in Geneva, during the World Health Assembly at the General Assembly of the World Federation of Public Health Associations, adopted for the first time a policy statement on Indigenous health. So understanding that we needed to acknowledge indigeneity, we needed to acknowledge Indigenous peoples and the inequities that Indigenous peoples face, and the context in which brought us to the place that we continue to remain, which is one of disadvantaged health and well-being. What we want to do is find solutions that our members and our association can lean into to support our Indigenous communities in the first instance. And when I say that, it's really for the systems and the practitioners that are really around these communities to understand how they can lean into actions and development of priorities and programs and interventions that are going to ensure that our Indigenous populations can thrive, not just survive. And as part of our work program, following on from the adoption of the goal last year and then the adoption of the policy on Indigenous health in Geneva in May, we have a draft policy statement on decolonising public health. Again, understanding that these things are not static, that they will change as different voices come into them and be part of them, but we needed a place to stand and begin. So this is our decolonising and public health policy statement. There will be an opportunity for this to be circulated. Primarily, it will be on the Indigenous Working Group of the World Federation LinkedIn page, and will be accompanied with a Google Doc so people can give feedback on their thoughts about this policy statement. And we want to give a window for this, which will be from now until around about December, for people to be able to give, to look at it, read it, think about it, and then give some feedback on it, that we might incorporate that before we put it forward to the General Assembly in May during the World Health Assembly next year that the Federation has. So key messages for our draft policy statement on decolonising public health are: one, is to overall acknowledge Indigenous people's experience inequities in health and the determinants of health. The second one is that addressing the ongoing harms of colonisation on Indigenous peoples requires implementing measures that centre Indigenous knowledges, systems and values. The third key message, decolonisation is distinct from other forms of social justice practice, as it must be positioned in relation to Indigenous experiences and priorities. And four, decolonising public health requires active participation and collaboration among Indigenous and non-Indigenous public health professionals. And I think that that takes us quite nicely into parts of the conversation that we're going to have today, especially around the role of non-Indigenous public health professionals. And next slide, please, Maria. Okay, so the bottom of the first slide and this slide talk about the imperative for decolonisation in regards to Indigenous health and the importance of understanding colonisation and the way that it continues to manifest and have an effect on the outcomes for Indigenous populations. And then that we're following through after that with the next slide, please, Maria, which is around the imperative for public health to understand its roles and responsibilities in regards to decolonising the space. And again, that's that conversation around non-Indigenous practitioners and their roles and responsibilities to supporting the work and the importance of the work in regards to understanding decolonising, and then what the actions are for the broader public health community. Next slide, please, Maria. And again, the policy statement absorbs into it this working definition that you heard earlier on. Again, just positioning ourselves in that place. If we needed somewhere to start, we need a definition to start from, and knowing that that will grow and change over time. And the possibilities to grow in different ways within the Federation and the working groups of the Federation and our collaborations that we can actually share with other organisations and other groups and other people within the Federation, the breadth of the work and the breadth of the different spaces that all will need their own definitions of a kind, if you like, and work programs to go alongside them. So again, this is our foundation of the beginning of this work. Thanks, Maria. We'll have the next slide. And yes, some more in the statement around considerations. Next slide, please, Maria. And then just the references that go along with the work that was pulled together. And again, I want to acknowledge Ariana and the significant work that she did in this space and pulling this together, along with Alec Kalak from the USA and some of the others, Dr. Summer May Finlay, Alana Gore, a number of players that have had great contribution into this space. So again, opportunity to feed into and give feedback on thoughts around this particular policy statement, which will be put on our Indigenous Working Group LinkedIn page, along with a Google Doc that will enable you to give good feedback. Next slide, please, Maria. Okay, in regards to the considerations for decolonising that were in the policy statement, and some thoughts for the conversation as we move into speaking with our panellists today. You know, again, decolonisation is a process or an idea that is closely linked with the process of indigenisation. So good point of, you know, separating out these two terms and, you know, how do these two terms play together? There are different schools of thoughts about the need for both of these terms. Decolonisation must be positioned within the Indigenous experience so as not to fall into and add on to other forms of social justice practice. This is really important. I think a lot of people get tripped over on this point, that, you know, if we're not dealing with the colonisation that occurred for Indigenous populations, then we haven't started at the beginning of this conversation. And often Indigenous populations get put into an other or an add-on category instead of the priority position in which they belong in terms of addressing the colonial harm and continued issues that exist for Indigenous populations being minoritised and experiencing deleterious behaviour. And then the last consideration here, you know, again, this is positioning the Federation really carefully, that we are largely non-Indigenous members in a non-Indigenous led and governed association, and the focus for our membership is conscientisation or socialisation and education and understanding and acknowledging, you know, where the Federation fits, but also this massive opportunity of having an Indigenous person at the lead and having an Indigenous working group that is very committed to supporting the Federation, to understanding its obligations as regards to decolonising public health globally. So I will stop there. I think there's a lot of information, there's opportunities in there for all of you online to be able to contribute and share your knowledge and experience and lived experience indeed into the space that we're growing within the Federation, and of course in our collaborations with others working in this space. So thank you very much again, Adrian. I will hand it back to you and the panellists.
Thank you, Emma. Wonderful. Just a reminder to everybody, that what indigeneity looks like. It has a number of different definitions, but it's recognition of 500 million people globally who are Indigenous. And of course, most of those people live in developing countries, and the other group of those of us who are in developed countries. One thing that connects us all is we live shorter, sicker lives than other people in our various jurisdictions across the planet. So now we have an opportunity to meet our panelists, and I'm going to invite them one at a time. I'll do a brief introduction, then they can introduce themselves, and invite them to give kind of an opening words around the particular topic today, which of course, amongst other things, is decolonisation and public health, focus on education and training, and anything they like to give around their kind of knowledge and journey to the space. The first person I'm going to introduce is Dr. Ariana Andrews. She holds a Bachelor of Medicine and Surgery from the University of Auckland. She's passionate about eliminating public health inequities and promoting Indigenous knowledge. She has also completed an internship with the Indigenous Working Group of the Federation, and she works as a professional teaching fellow and is studying towards a Masters of Public Health at the University of Auckland. So, tēnā koe, Ariana, would you like to introduce yourself and then give us a bit of an overview for you? Kia ora.
Kia ora, Adrian. Tēnā koutou, he uri tēnei no Waikato Tainui me te whakatohia, ko Ariana Andrews tōku ingoa. Kia ora, my name is Ariana. I'm from Aotearoa, New Zealand, from the tribal groups of Waikato Tainui and Te Whakatohia in the North Island. And yeah, in terms of how my journey into the space of thinking and working toward decolonization, it's linked to being really passionate about health equity, which is the topic of my thesis. And I think it's really important to consider the types of systems and structures that we need in place if we do actually want to realize health equity. And so when thinking about how to eliminate inequities, it has to involve dismantling colonialism. And when I speak about that, I'm recognizing the harms for Indigenous peoples in particular, but also recognizing that harms are not limited to Indigenous peoples. And so the imposition of systems that situate some as superior and others as inferior, and that destroy relational ties that we hold to one another and to our environments, they're incredibly harmful for Indigenous peoples, but they're also incredibly harmful for all of us, regardless of whether you're Indigenous or not. And I think that links back to why this is so important for Indigenous and non-Indigenous collaboration on this topic. And so, yeah, thinking about why decolonization is really important for us as public health professionals, I think we need to understand the harms of colonization in both historic and contemporary contexts to be able to recognize colonialism within our systems and institutions, and then be able to work collectively to dismantle colonialism and to build new systems and structures that will support Indigenous liberation and self-determination. So yeah, kia ora, and I'm looking forward to talking about this further with our other panel members.
Wonderful. Tēnā koe, Ariana. Now I'd like to invite Dr. Lwando Maki, who's joining us from the Republic of South Africa. Lwando also has a Bachelor of Medicine and Surgery from the University of Cape Town. He has many roles, both governance and leadership roles. He's also the current president of the Public Health Association of South Africa. And another shout out to acknowledge that they are hosting the next World Congress in Public Health. We're very excited about coming down to the Cape to see that. And I'll let him introduce himself and the topic. So thank you very much, Lwando. We appreciate how busy you are, and it's wonderful to have you here in our presence.
Thanks so much, Adrian. Can you hear me clearly? Oh, great, fantastic. Hi, everyone. Thank you so much for joining us today. It's always a pleasure to collaborate with the Indigenous Working Group for the WFPHA. I'm Lwando Maki. I'm from South Africa. I'm a medical doctor by training, as said by Adrian. I'm a public health medicine specialist. I'm finishing my second specialty in internal medicine. And I'm also the president of Public Health Association of South Africa, secretary of the African Epidemiological Association, and a few other leadership nationally, regionally, and globally. Today's topic is quite important in decolonization, specifically looking at training and education. It's very, very specific. And we have to remember before we start engaging in this subject that there is no revolution without having any youth involved in it. And one of the more prominent actions that cause youth to go to it is one of them is education. And that has been seen, quite a number of times in history. I mean, spanning back from anti-colonial struggles from the 1950s to the most recent, struggles relating to Rhodes Must Fall, which would happen in South Africa in 2015 and 2016, which initially started related to fees and moved on towards decolonizing the curriculum. And also in the UK with Why Is My Curriculum White? As you can see, it's something that is happening and is quite active. And when we approach this, we need to also remember that, there's a few things that have to come out of it. And that's from an article that was written by Kath et al., looking at a review at how to decolonize the health sciences curricula. And I'll stick to health sciences specifically because that's where we are as the World Federation of Public Health. And I won't span into other sectors related to education. And we need to cover a few things. I mean, the first one is that, as we engage with the subject, you have to recognize and acknowledge the impact of colonialism, exactly about that, and recognizing and acknowledging the impact it has had on a crucial aspect of the culture of the people in that region. The next one is also, you have to recognize and challenge the legacy of colonialism after realizing the impact of it. And also, you have to look at who are these voices that are saying about colonialism, decolonizing. And that will be looking at such as groups as Indigenous working groups such as these ones, because you find that there might be voices, but you might find the voices that should be there are underrepresented, and we need to address those things. And the other one is to find tools to address social justice, not only just by through education, but that has to translate into policy so that there's some justice that comes out of it. And one of the other themes is to also think of is with colonization is whether there's inclusivity and diversity. And that's quite important because you cannot have this conversation if you don't have everyone at the same table and everyone getting to see through the lens of decolonization from the people themselves that are affected. And also looking at restoring Indigenous knowledge. As you know, there's different Indigenous groups here in Australasia and so forth. And sometimes over time, some of that knowledge might be lost, and we need to get that back and make sure that it's part of the curriculum itself. And one of the vital parts about it, you need to make sure there's a partnership with locals and include them, the community themselves, those who practice the knowledge and they actually have the knowledge that we're trying to get back. And also seizing the moment in such a way that as the conversation happens, we have actions that are tangible and as part of the planning and strategic planning, so that that moment doesn't go past, or maybe it might be reversed. As you've seen, there's been challenges in different parts of the world. I mean, with the most recent one related to Maori Health Council in New Zealand and how it's changed. So even though you have made progress, you need to make sure it's maintained and carry on the momentum related to that. And then also recognizing that it should be formalized. Decolonization should be formalized. And that's why I do applaud our president, Emma, for taking forward this policy, because it has to be formalized. It can't be a discussion that will go over the years. It has to be part of the policy. And that's what we're stepping to as an organization. And as being the past deputy of the World Federation Public Health Junior Division, Young WFPHA, it's something that really embodies what we want to do also. And we really appreciate that and the leadership that comes with it. She's already committed history, but it's also her story that she's bringing that. And we're glad to see change that we want to see and embody it as an organization. So I'll stop there for now, and we can maybe engage further and look forward to engaging with everyone. Thank you.
Thank you very much, Lwando. And also thank you for acknowledging, policy has implications in every way and facet. So we need to influence that policy or create that policy. Otherwise it gets created for us. It's my privilege to introduce our next member of the panel, Kath Baldock. And she is an associate professor and leader in education, higher education and academic practice at the University of South Australia. She also has a number of governance and leadership roles. Alongside her academic leadership, Kath is an active researcher in educational initiatives as well as public health projects. So it's wonderful to have another Indigenous woman here on our panel today. So tēnā koe, welcome, Kath.
Natalia, Adrian. Nā Māni, so nā Ngāri Kath Baldock. I just want to first acknowledge that I live and work on Ganiata, acknowledge and pay respects to the Ghana people for their custodianship of country. To position myself, I'm a person of Aboriginal descent whose family has been disconnected from country and community due to the impacts of colonisation. So I'm on my own personal journey of decolonisation and connecting back to country within working in this space. So I've worked in decolonising public health curriculum firstly, and then curriculum more broadly across disciplines for around the last 12 years in the higher education system. My focus now in more senior leadership roles is on leading teams in this work and influencing the decolonisation of higher education systems to support this work. So that active resistance of the systems within which we work that continue to create barriers to engaging with Indigenous knowledges, ways of knowing, being and doing within curriculum. So for me, education and learning is a transformative process. It's not just an academic activity. It's actually a process in which we aim as educators to change hearts and minds, to influence our students in ways that will develop them as, human beings who enter the workforce with the ability to be culturally responsive, to centre Indigenous peoples, Indigenous knowledges and voices within their public health practice. And so, I just feel a real privilege to have had the opportunity to engage in work to decolonize curriculum and Indigenize curriculum within the higher education system. I'm also a board member of CAPHIA, so the Council of Academic Public Health Institutions Australasia. And in that role, I'm also on the advisory group for the renewal of the public health competencies, which is currently being undertaken by CAPHIA for the Australasian region. As part of that process, I think we're at a really critical point in time where we're having these conversations more broadly in the public health sphere, not just across Australasia, but globally, where we can really focus and consider centering Indigenous voices in the process of renewing competencies for public health. So what do we want our graduates to look like? And, to really consider how that might look in terms of place-based approaches within different Indigenous communities across the globe. And so I think, there's a lot of work to be done, but it's really exciting to see these kinds of events happening and the momentum building around this space, where we have not just Indigenous voices pushing for the decolonizing of curriculum and Indigenizing of curriculum, but our allies as well starting to gather around us to do this work. So Natalia.
Thank you very much, Kath. It's lovely to have you here on our webinar this morning. Look, we want to invite people who are joining us to throw in a few questions, but I might start with a couple of questions that we've prepared. So one of them is, who teaches what? Navigating the complexity of the space as both an Indigenous and non-Indigenous academic, how would you feel about a non-Indigenous academic teaching your or this cohort or content? I'll invite any of our panelists to go.
I can jump in first, seeing as I'm on camera. It's an interesting question, and I'm not sure that there's an answer that's the right answer. Certainly in the work that I've been involved in, one of the ways in which we've been supporting allies particularly, but also supporting my Indigenous colleagues in this space who, have such a high workload because everybody goes to them for, developing or teaching Indigenous curriculum, is that the decolonizing work, so the unpacking of what does it look like to operate within a colonial system, what are the impacts of colonization for Indigenous peoples, those topics can be taught by allies, and perhaps in some contexts should be, given the load that Indigenous peoples carry in having to share experiences of colonial colonialism and the impacts for them. When it comes to Indigenous knowledges, we would tend to have Indigenous people teaching those knowledges, either on their own or in collaboration with allies.
Oh, great, thank you. Any of our other panelists like to offer a response?
If I may, I mean, unless if Ariana wants to go first, ladies first, if you want to. Okay, but thanks for allowing me to go. Okay, thanks for that question. I think, I agree with the previous speaker. It's not a straightforward, yes or no answer, but we do have to acknowledge that it's not just about the person teaching it being Indigenous. It must be that everyone who does teach should be aware of this topic and should be able to give an Indigenous perspective, and it should be inculcated within the training that allows the teachers to train the students. So I think it should be something that's inclusive in the curricula of the teacher, first and foremost, so that it can also be able to impart and understand with true meaning of what's the purpose of having decolonization of the curriculum. So it means that, one, there should be cultural competency within the training of the trainers, meaning that they should be having a good, sound, and a seeking mind relating to educational foundation of diverse cultural and ethnic groups. And that equates into having skills and knowledge and understanding about other cultures, and allows for those trainers to be able to train healthcare providers who do have that awareness of the cultural diversity. And also, it must be that there should be a cultural humility for those teachers, which can also impart to the students, meaning that they should have cultural awareness to self-examine themselves in depth in terms of their own cultural and professional background and how it relates to those they teach, and be aware of the cultural differences. And that equates to our ability to, collect relevant cultural data, which will probably be endorsed as a decolonized curriculum to be able to be taught to those students, and for them to understand the problem solving. And problem understanding also involves having to understand the cultural humility and the cultural competency. And it should be a desire within those cultural educators to be able to want to impact that cultural diversity. And those are the things that I think are quite important. And it's always a bonus sometimes to have a person of Indigenous background, because they give context that you cannot learn, context that you grew up with, context that they experience day to day, which is a bonus. But as I said, the core should be that educators themselves have to be understanding what it means for the curriculum to be decolonized itself, and to be diverse and understand the diversity and cultural backgrounds of the students that they teach, and be aware of their own culture. Thank you.
Thank you. Ariana.
Yeah, kia ora. Yeah, I'd like to acknowledge very strong agreement with what both my other panelists have said. And yeah, just acknowledging that to engage in teaching related to decolonization, I think not everyone has to necessarily position themselves as an expert. And so I think that might also be a useful distinction, whereby I think if someone is non-Indigenous and they're engaging in education on this content, I think that distinction between decolonization and being very clear about that unpacking is very important, whereas leaving that space for indigenization and what those new systems and structures might be being led by Indigenous peoples is a very important distinction that I think it's useful to uphold. And I think also thinking about the ways that decolonization gets implemented in curriculum, that if those who are engaging in this teaching aren't aware of how colonialism is operating within their curriculum, they will perpetuate it. And so whether or not they want to explicitly identify their curriculum as decolonial, I think it is important to have that analysis and have that framework to apply to whatever they're teaching, because colonialism touches everything. And if they're not acknowledging it, if they're not actively engaging it, and if they're not actively seeking to make it decolonial, then they're going to be perpetuating harm. So I think whether or not, yeah, like what this will look like for different people will be different. But I think just acknowledging you can't just take a step back from this if you're non-Indigenous, because that would be perpetuating colonialism. So it has to be an active step, and whether or not you take leadership in that is different. But I think there has to be commitment and involvement from all of us.
Thank you, Ariana. Madam President.
Oh no, look, there isn't a lot more than I can add to what the previous three have said. I want to say I really like what Lwando said around cultural humility. I think cultural humility is key in this, and there's a couple of things. There's there are only so many of us who are Indigenous or of other descriptions affected by the colonialism, that we do need the allies to understand their role and authentically lean into their role in terms of supporting the conversation and the work to occur in the best way possible. And that term, cultural humility, I think, is the ideal one for people to reflect on when they think about themselves and their practice. What does that mean for me? I think people struggle with humility at the best of times, but that is a really digestible and I think a word that I think a lot of people can embrace is the idea of humility in its best sense. How can I be the best that I can possibly be in the craft that I practice, which in this instance is teaching and education. And to me, that's around understanding the context in which you came into this space, being as educated as you possibly can be in the way that you can be. So if you are not Indigenous, if you are an ally, understand and know what your place as an ally is, so that you can best then lean into that cultural humility, so that you can do the best job on behalf of your role in that relationship to this work. And these are the things that we talk about all the time. How can you be the best human you can possibly be to get the best outcome for all of the humans that need it, which is all of us? Oversimplifying it, I know, but these guys said it all so beautifully. Thanks, Adrian.
I'm just also reminded there have been times across the planet where we've been places where non-Indigenous health professionals have said that, how can they do what they do better, give better service to Indigenous folk. And I think some of the comments that always were coming through is that people demanded excellence in the craft that's been given, and that to do that requires a significant amount of knowledge and insight with regards to the people that you're working with and for, and in terms of the nuancing and all those things that make that are special with regards to who they are. And then you can add the medicine to that and create better human beings. And one of the ultimate outcomes is creating leadership and knowledge to non-Indigenous people by association with Indigenous folk. Another question that came through was, do you actually have any examples of successful decolonization in public health and or education and training that you're aware of, historically or in place now? Do you have any examples of successful decolonization in public health, education and training?
I think that's a very broad question. I think it seems like a very simple question, but it's a very broad question because it kind of there's a lot of places you could answer that. But for me, I'm just going to give it. It's not, when we're talking about what kind of education are we talking? We're talking about in the university, or we're talking about within the curricula themselves. Then I can't answer that question necessarily. I can give examples of things that I've seen occur and that I've been involved in here in New Zealand in terms of the opportunities to teach into the space where we are able to talk about authentically being good treaty partners here in New Zealand, for example, and the way in which we understand the treaty in New Zealand as a framework for being a really good practitioner, no matter which space you're in. And those have been very successful in a number of ways. And then there are examples of even the Federation is an example of education and decolonising education being successful, but it's not in the way I think that this question is being answered. So I think it's a broad question where we can find lots of different smaller examples, but maybe we'll hand it over to one of the panelists, see if they have some other more specific ideas or just thoughts. So I'm going to stop and maybe I'll just give it to Kath.
Well, should we go to Kath and then Lwando?
Natalia, Emma. I think one of the, I mean, this is a small example, but in my institution, we have started mid last year. So it's been just over 12 months, running workshops for academic staff who are educators on decolonizing higher education. And that is for staff across all disciplines, but many of the people that have attended those workshops are in health. And I think it kind of speaks to some of the points that Lwando made earlier around developing cultural humility, understanding one's own positionality when teaching in this space, recognizing what you know and what you don't know, and that's okay, that you don't have to be an expert in Indigenous knowledges to be an excellent ally. So that's what these workshops are targeted towards, predominantly non-Indigenous academic staff. But I think that capacity building is so important. Certainly, you know, in Australia, it's just 3% of our population identifies as Aboriginal Torres Strait Islander. And we know that Aboriginal and Torres Strait Islander peoples are underrepresented in the higher education system as academics, so educators. And so we really need allies to step up and participate and work with us, alongside us in this process. And so as part of that, I think it's really critical to do that capacity building in this space so that our allies are confident and competent in teaching this curriculum.
Kia ora, thank you. Lwando.
Thanks so much. I mean, I have to agree with Emma. I mean, this is a very broad question, and it's also very hard to come to an answer that doesn't address it in a certain regional context of where the study was done. And there's not enough literature to show. I mean, that, well, there is some, but not enough to be able to show a concrete evaluation system of that we're achieving that decolonization. And the other thing, Adrian, is also meaningful success and meaningful decolonization, because the problem is that you can have programs, and as Kath had alluded to, you can have different strategies that you implement, but not necessarily meaningful. It might be a person who's just forced to sign a attendance register and then being there, but not necessarily taking that back to their tutorials. But I do have some suggestions, I mean, that come forward. I mean, one of the means is through having inside the curriculum itself formats that allow for you to engage in these decolonization practices, such as having tutorials that are focused for students to engage with a specific time that's part of it, part of the education that engages with it, aside from the pedagogy of the teacher itself. And then, of course, what Kath is alluding to in terms of workshops that help the department to change and the teachers to change themselves. But as you can say, as I've said earlier on, you don't find necessarily the same practices when the teacher is being taught. And how much of a value, if you're not being assessed and being part of your assessment as you're coming out as a teacher, that you're actually going to keep that as part of your training. It's always questionable to say that, So for me, I would love to see more of the teachers' programs themselves to be alluded. And also the last part, Adrian, is that there's not part of your key performance area. So you're not actually being assessed in terms of your job, as you are actually achieving and addressing this as a key performance area, which is something that needs to be done, I think, so that it's clear and stays with it. And the persons aware that are not only assessed purely as what I do in my practice and how I teach, but also what is the message I'm giving, and am I trying to adjust this change? And if that's a meaningful change, I mean, whether the person wants it or not, sadly, some people don't want change. I mean, it's been shown in different studies that there is resistance to decolonization. But if it impacts your financial impact by it being part of your KPAs, your key performance areas, there will be meaningful change because it affects you directly. And so those are the things. It's more of a discussion, not an answer that I'm giving. I know, but I hope it stimulates some thought process throughout the members. Thank you.
Great. I'm going to take one of the questions from the floor. Education and training is more than a single organisation. The embedded systems are deeply colonised and powerfully embedded through interacting systems. How do we start in a meaningful way?
I'll start. I think, yeah, absolutely. I mean, yeah, this whole work is about, you know, impacting in multiple places and multiple spaces at the same time. And starting in a meaningful way, the best thing that we can do is acknowledge that this is, I mean, Lwando just alluded to it, is acknowledge that this is an issue that needs to be addressed. I mean, I think we've all experienced that on this you know, panel tonight, that the biggest barrier in the way of our success in addressing this is the acknowledgement that it exists. And so that is the very, very beginning of the work. So how do we ensure that, you know, there's enough information out there for people to actually say, okay, this is something that needs to be addressed. And I think the other thing that Lwando also said in his last response was the importance of embedding the importance of addressing these things in multiple places. When you're talking about, you know, when you're talking about, maybe you're talking about legislation, but particularly when we talk about policies within organisations, whatever those organisations are and or institutions, that these become part of BAU, that they're not just a nice to have, so that it becomes an embedded part of the culture and the practice of all of the organisations that are needed, which is just about everyone on the planet, if you ask me, to enable that there is that impact in all of the spaces and all of the places at the same time. Right, that's my 2 cents. I'm going to hand it over to, I'm going to go to Ariana.
Yeah, kia ora, Emma. And yeah, I think, yeah, agreement. And I also would just like to emphasize that, like, when we're thinking about how to begin, like, no individual has to carry this all. And so really emphasizing the collective nature of this, both as a practicality and as a necessity. And so if you're thinking about how to begin and where to start, find those who have either already started and are already doing this work, and find those who are interested in doing this work. And then together figure out what that means within your local context. So yeah, there's not going to be a single way to address things. It will also depend on the level of power and security you have within your particular setting, because that might influence whether or not you have to be a bit more cautious about things, which I think, again, links to the power of working as a collective. But yeah, I think just like finding others who also want to go on this journey with you, and then building that sense of community. So yeah.
Great. I'm going to summarize one of the questions. We have time for this. Is it useful to decolonize the curricula without first tackling the hierarchy of knowledge, particularly in education and health? I know it's kind of very similar question, but I mean, is this the boiling the ocean stuff, or is it acknowledging that we really need to tackle the hierarchy? Thoughts?
So just to clarify, is the question related to, in terms of hierarchy, related to management, or is it relating to the content itself?
Well, I don't want to be flippant. I'm thinking animal farm hierarchy.
That's what I was wondering. You know, well, I mean, you can't. I mean, it's not a straightforward question. I mean, it's or a straightforward answer. But what I can do say is that, you know, you can't have just a top-down approach only. You need to be top and up, and bottom and top, actually, because you might find that the management, as I was alluding to, can have these attendance places where you have to go as staff, or students might go, and yet there's no buy-in in the platform, and you don't actually reach your objectives that you're reaching, you know. That's the first one, but you do need to have them, because especially in the nature of the key performance areas, and that we're monitoring if we're getting there, and that also the curriculum itself and also the examination itself, and even the setting of questions with the cultural context. It's not a straightforward person comes in with respiratory symptoms, therefore pneumonia, or whatever the differential may be. It must also be the context of how they live, how they interact, and what's your management. And as part of you get marks as part of that. And you can never get that without having approval from, the faculty board, which is the top part, and the university itself. And also the university has to be behind you, because at times you might find that even parents who send their children to your universities might actually say, hey, we don't agree with what you're doing here as a university, and management has to also stand fast with those allegations. And that can happen. You've seen some issues in America, with fees, with Black Lives Matter and so forth, within putting it in the mainstream education at times. So you definitely need to have that appropriation. And then the last one would be that, they need to remember that you can't have a curriculum or students or even teachers without having management to build strategic plans for the students themselves and for the department. And you need to make sure they have that as part of their agenda item in those meetings. And they must not be forgotten about that, and to support those people who are actually lifting up the flag relating to decolonization and supporting them. Because I'm sure, I don't know about you, Kath or Emma, Adrian, whenever you want to say you want to have a meeting relating to decolonization, I'm not sure how many staff members actually come to the meeting. It's not just, so you need to actually have that, and vice versa, Ariana, if you and your students are doing it. So it's something that you have to have it by indefinitely, thank you.
Thank you. Now, our time slot is almost up, but what we're going to do, we'll extend it out a wee bit longer. Normally, we will take an hour and a half, but we've had to keep it a bit tighter in this particular one. What I'm going to do is I'm going to actually, in terms of the order of ceremony, I'm going to invite Emma to eventually give us a closing offering or karakia. But in doing that, and then she's also going to introduce the next event, the follow-up event from this. But what I might do is just go around and any follow-up comments from our panelists, and then I'll say a couple of words and then hand it to Emma. So let's start with Kath.
And Natalia, Adrian. I think my closing comment is, I guess, in relation to the final question, but it relates to this whole process. For me, decolonization is an active resistance. So I really, that definition that you put up really resonates with me. It's beautifully written. It's an active resistance against colonial structures, systems, processes. And so decolonization isn't different from it is about dismantling hierarchies and hierarchies of knowledge and centering Indigenous knowledges within that process. So yeah, really grateful to have had the opportunity to be part of this conversation this evening, Natalia.
Kia ora. Ariana.
Yeah, kia ora. Yeah, thank you for having me here. And yeah, I think I just like to acknowledge the complexity of what decolonization is, and just to recognize that just as colonialism is an incredibly complex and enduring system, like decolonization will be incredibly challenging and it'll be multifaceted. And I think also just kind of engaging in this with different timeframes in terms of actions. And so I think there are some things that can be implemented within 12 months, and there are other things which might take a generation. And to kind of acknowledge that they're both important, and it's all part of decolonization, and it's all part of this broader process, and figuring out how you might be able to move that progress forward in whatever capacity that you're able to do. But yeah, I think just taking a bit of a long-term vision around this, and just recognize it is incredibly hard. It's going to look different in different places. And there's not going to be like one single right way to do it, but to just, figure out what's going and work through the process. Kia ora.
Thank you, Ariana. And before I invite Lwando, just a reminder for people, if you look in the chat, you'll see the links that Penny has put in relative to who's on here and some other things that we've been alluding to in our previous program. So, Lwando. Welcome.
Thanks. That was really fast. Yet there's so much to say and share. It's pretty, time goes flies when you're having fun. And I want to say that I really enjoyed having being on this platform with all of you, and I've really enjoyed the discussions. And I hope some of you have also, started a conversation in your head that you might take back. And that leaves the point of starting. My words to depart with you. You have to remember that all change can come in different forms. People have different times and different capacities which they can use to bring the change. So whether you are having a discussion on decolonization at the barbecue or braai over a beer, it starts somewhere, and I do encourage to have it. And also all the way to your own faculty and also to your own different leadership posts and organizations. Each part helps, and we build more allies with that. And also to recognize that this is discussion is not only for those who don't identify as Indigenous, but some Indigenous people themselves might not take this highly, and not to the detriment of the movement. So please do engage everyone with anyone towards trying to achieve this. And for those who are in education already, I think, for you to address this, I'd suggest you look at blended learning as a starting point of how you can maybe try to look at examples of how to bring decolonization. And I can share some research articles around that so you can enjoy it. And that's it for me. And I'd like to, last one, welcome you and invite you to South Africa for the World Congress in 2026 in Cape Town. We're looking forward to have you all. And we definitely have some good rugby here. We got great beaches, great skis. And we love New Zealand, we love Australia, we love you guys. And everyone else is online. Please do come. Thank you so much.
Thank you very much, Lwando. Before I hand it over to Emma, I just want to acknowledge particularly Ariana, of course, and Lwando and Kath for being on our panel. I certainly appreciate how small and tight the window's been. I also want to just acknowledge those who are going to be listening to this at a more sensible hour to them later on. And a really important acknowledgement for Penny, who's the super organizer, who's also been making sure that the chat stuff is in there. Thank you very, very much for those of you who are coming in from around. And Maria, who is in our office in Geneva. And we'll see you quite soon again. But thank you very much for the work that you do. And I will just acknowledge you all by handing back to Emma, the president of the Federation, to fill you on about what's happening next, and also offer a blessing of sorts. So kia ora tātou, tēnā koe, Emma.
Thank you, Adrian. And I just want to say thank you incredibly to all of the panelists, Kath, Ariana, Lwando, for your time with us this evening. It has been a really rich conversation and also a great demonstration on how much more conversation and work there is still to be done. But these conversations fill me with more energy to continue on the journey that we have in front of us. I mean, the really important points that I think it is important for everyone to take away in this work, and I think each of the panelists have sort of touched on it to some degree, is that acknowledging that the issue is what the issue is really, really key to this in the first place. Know your historical context, your space and place. Understand your sphere of influence. We all come into this at different places with different impacts to make. And then be generous with yourself around what you can do and how you can do different things in different spaces. But more importantly, work with others. Work with others in this space, because it isn't just for one person to carry this work. It's for all of us to share and to move forward together, utilising our spheres of influence and our different opportunities to make the change. And we do have success to draw upon, and as Ariana very wonderfully put, some of these things will be quick and some of them will take a long time, but we just know that if we understand what the work is that needs doing, we know why it needs to be done, then we can take steps towards achieving what needs to happen, which ultimately is a place of sovereignty and equity for everybody. So just want to thank everyone once again for joining us in this really important conversation on behalf of the World Federation of Public Health Associations and the Indigenous Working Group.